Coffee and blood pressure? Is coffee bad for high blood pressure? Welcome back to the channel, health enthusiasts. Today, we're tackling a question that's probably crossed your mind more than once. Especially if you love your morning brew. Is coffee bad for high blood pressure? It's a topic surrounded by a lot of myths and misconceptions. So we're going to break down the science to give you clear, actionable insights. First, let's understand blood pressure. Simply put, it's the force of your blood pushing against the walls of your arteries. When this force is consistently too high, we call it hypertension, or high blood pressure, and if left unchecked, hypertension can significantly increase your risk of serious conditions like heart attack, stroke, and kidney disease. Now, for the coffee connection, you've likely heard that caffeine can temporarily raise blood pressure. And that's true, especially for those who don't consume it regularly. But here's where it gets interesting. Extensive research suggests that moderate and regular coffee consumption doesn't have a negative long-term effect on blood pressure for most people. In fact, studies show that consuming 1 to 3 cups of coffee per day typically doesn't alter your risk of hypertension. The exact reasons why frequent intake has minimal impact are still being explored. But the evidence points to little to no risk when coffee is enjoyed in moderation. While moderate coffee consumption is generally safe, it's crucial to be aware of the risks associated with excessive caffeine intake. The U.S. Food and Drug Administration, or FDA, recommends capping your daily caffeine consumption at 400 milligrams, that's roughly 4 to 5 cups of coffee. Exceeding this amount, or consuming caffeine infrequently, can lead to side effects like a fast heart rate, anxiety, insomnia, nausea, tremors, and increased urination. So, sticking to that recommended limit is key to avoiding these potential issues. So, who should be cautious or avoid caffeine altogether? Well, certain groups need to limit or even eliminate it. Pregnant individuals, for instance, should keep their intake under 200 milligrams per day, or about 1 to 2 small cups, as caffeine can pass to the fetus. If you're particularly sensitive to caffeine, experiencing jitters or headaches from even small amounts, it's best to reduce your consumption or switch to decaf. Other individuals who should consider avoiding caffeine include those with arrhythmias, stomach ulcers, GERD, severe hypertension, and people taking certain medications or supplements, such as some asthma medications, antibiotics, and heart medications. Always have a conversation with your healthcare provider about potential interactions between caffeine and any medications you're on. Your doctor is your best resource for personalized advice. Now, for some good news. When consumed in moderation, coffee may actually benefit heart health. Research suggests that enjoying 1 to 3 cups daily is associated with a decreased risk of heart failure and a reduced risk of death from cardiovascular disease and other causes. While more research is always ongoing to conclusively link coffee to coronary heart disease risk, the current evidence indicates that moderate enjoyment of coffee can play a role in protecting your heart. It's truly fascinating how this beloved beverage can be part of a healthy lifestyle. If you're looking to balance your love for coffee with optimal blood pressure management, or simply want to explore alternatives, there are some fantastic options available. Consider half CAF or decaf coffee, which offers similar taste with significantly less caffeine. Herbal teas like rooibos, hibiscus, and chamomile are naturally caffeine-free and gentle on your system. Green tea, while still containing caffeine, has much lower levels than regular coffee and is packed with antioxidants. Golden milk or turmeric lattes provide a warm, comforting, and caffeine-free experience, often with anti-inflammatory benefits. And of course, naturally flavored water, whether sparkling or fruit-infused, keeps you hydrated and can be a refreshing alternative to hot drinks. Small, sustainable steps like these can make a real difference in supporting steady blood pressure, while still enjoying your favorite beverages. So, to recap, caffeine can temporarily raise blood pressure, but moderate coffee consumption, around 1 to 3 cups per day, does not negatively affect blood pressure or overall health for most people. In fact, it may even offer protective benefits for your heart. However, It's crucial to stay within the recommended caffeine limits and be mindful of individual sensitivities or health conditions. We hope this deep dive has shed some light on the complex relationship between coffee and blood pressure. Understanding these nuances empowers you to make informed choices for your health. If you found this video helpful, please give it a thumbs up. And for more useful health information, be sure to click that subscribe button and hit the notification bell so you don't miss our future videos.